So tonight I'm going to use my notes, and this is my notepad here, and I'm just going to reflect on some of the sleep points that were shared by a nurse practitioner, and her name was, just to give credit to the author, Cynthia Rodriguez, and she, I think, works out of Coralville in Oregon. So thank you, Cynthia. Many of the stuff I've known already, and I practice with my patients, but I thought it was a great overview, and I'm just going to run through the information. The first reason for the information is it's been shown that it's the #1 treatment for sleep problems. Now, as I've shared in the past weeks, sleep is a condition of the limbic system, which is the same area of the brain where chronic pain is controlled, right in the heart of your brain. So often chronic pain is associated with sleep problems, and sleep problems are associated with chronic pain. So let's have a look here. Yeah, so it's the #1 treatment, and talking about it. So what we're doing tonight literally can help people, and if you've got some knowledge about this subject, can help up to 80%. It's an amazing number. 80% can be helped by this information. And also you can get a reduction in the need of sleeping pills by 80%. Wow, that just blew my mind to see that stat. But you know, if you know what you're supposed to do and you can deal with the fear around sleep or lack of it, then it's manageable. And that's what the evidence is showing. You know, that once you learn these things, it's long term, it doesn't cost you anything, and there's no side effects, and basically it's a lifelong investment that you're putting your time into. So tonight, here's for your investments in the future. So think about cognitive behavioral therapy. First is cognitive. So what are the cognitive things? What are we thinking? What do we know? What are our ideas around this subject? Well, first of all, it's normal to take 20 to 30 minutes to fall asleep. Well, if that's you, you can tick that box and say, good, I don't need to worry about that. You know, myself, I'm off to sleep in a flash, so that doesn't apply to me. But you know, many people take a lot longer than 30 minutes. So if you're 20, 30 minutes average, that's good. Second thing is, if you have a bad night and you're not sleeping so well, maybe you're up to the washroom more, or your child is sick, don't worry about it, don't stress. It's not a catastrophe, you're not going to get sick. It's just one of those things, you can get more sleep the next day. The second thing is, it's normal, the third thing is normal to wake up. So if you wake up for whatever reason and go back to sleep quickly, no problem. You're not going to lose any major health effects because of that. Going to bed earlier is not necessarily better. You know, I love the adage, and I actually often talk to my patients about this, is if you sleep 2 hours before midnight, say go to bed at 10, it's worth kind of 4 hours, but as opposed to going to midnight and then you just get the set number of hours. Now, my personal experience is if you sleep a bit earlier, you're more refreshed, rather than going to bed at 1 and getting the same hours. But the evidence shows that it doesn't really matter when you go to bed. The key thing is to go to bed at the right time for you. Pills are only improving sleep by 10 to 15 minutes. Now that just blows my mind. Like, really? People spend money to get side effects, and it's only helping their sleep on average 15 minutes a night. And that's not a new stat from this weekend. I've heard that before. So that's really quite interesting. And at the end of the day, sleeping pills are not preferred. And I think one of the reasons is you're getting less REM sleep, that qualitative sleep where you dream. So that's kind of almost removed when you're using sleeping pills. And that's something that my patients have commented on over the years. So the second component of CBT for insomnia or sleep is behavioral. So what are the behavioral things that we should be doing or not doing to optimize? Well, first thing, get a dark, cozy, cool, quiet environment. Yes, tick off all those boxes and get the environment right. It's really important. Best to avoid caffeine after 2 p.m. So no caffeine after 2, and that includes a cup of tea. If you're from the old country like me and you like a cup of tea, if it's caffeinated, no caffeine after 2. That may help. Avoid long naps in the afternoon. I prefer short naps, and I think that's a great thing as an energy booster if you can do that. So set your alarm, have a 10-minute nap in the afternoon. But long naps, an hour or so, is just not good because it disrupts the sleep cycle. The third thing, avoid any nicotine in the evening if you're a smoker. and avoid heavy meals also in the evening. So eat early, maybe 5 o'clock, and lighter meals. If you can, have your big meal in the middle of the day. I think that's a great idea, something I've talked to patients, over the years about. And screen time, oh yeah, screen time. This week I even had a discussion with a patient who, they mentioned, in fact more than one, talking about in their bed and they're not sleeping, they put on the TV, kind of pulling my hair out, like, oh, no, because what, the flickering, not that we're aware of, but the flickering effect of the light coming from the TV screen and your cell phone and other IT equipment literally stimulates your brain, which is not going to help you sleep, because we need to be calm. That's a great time to be writing. So if you're up in the middle of the night, you don't know what to do, get up out of bed and do what you need to do first, and then grab your paper and pen or a notebook and write some stuff down. It will calm your brain down, and it will get that time in the day so you're too busy to get some writing done, because that will help your chronic pain, and a great way of actually helping you sleep as well. So go for that. And the next thing is a regular time. Get that regular time in for you. Don't go all over the shot, 8 o'clock at night, 10 o'clock at night, 1 o'clock in the morning. Kind of stick to a regular time that is good for you. Moving on here, stimulus control. Yeah, bed is for sleep and for sex. That's it. Nothing else, because we need to make a positive association with our bed for a restful place. Or I think having sex is fantastic, obviously. But yeah, stick it to simple things, and you don't want to be so overstimulated, which we've mentioned. The next thing is a big subject. It's called bed restriction. Now, I've read this before. There's a lot of research, or some research behind this subject, and it's this: if you have, say, 6 hours of sleep, you do not want to go to bed 4 hours before then, or 2 hours before. You take 2 hours to fall asleep, you sleep for maybe 3 hours, you're up for 2 hours, but you're lying in bed and you keep sleeping for another 3 hours. So that's your 8 hours in bed, 10 hours in bed, and you get 6 hours sleep. Don't do that. If you're awake, you're not sleeping, get up and do something, walk around, do a few things, and then, sit down, relax, get the notepad out and write a little bit. When your brain's calmed down, you feel a bit sleepy, go back to bed and sleep. So avoid sleeping, avoid activity in the bed that keeps you awake. So restricted bedtime. Yeah, a very nice thought I thought was, if you have a dimmer light, make sure in your bedroom there's soft white light, or if even better, a blue light, just because it's calmer on our nervous system, and that may make a big difference. That's something I'm going to look to doing. I love this one. Paradoxical intention. Well, what does that mean? Well, what it is, you lie in bed and you say, right, I'm not going to fall asleep. I'm not going to fall asleep. I'm going to stay awake. I'm not going to fall asleep. I'm going to stay awake. So you tell your brain the opposite of what you want to do. I've tried this over the years, many years ago, and it actually worked quite well. And this actually reduces anxiety around sleep. And that's why it's a great little tip. So yeah, reduce anxiety with your sleep by telling yourself, I'm not going to sleep. Try it. See how you get on with that. The other one is quiet bedtime activities. Yeah, sleep hygiene and preparing for sleep. You don't want to be, listen to your favorite rock and roll music. You don't want to be dancing around or just come back from a run at 10 o'clock at night. Just calm down the last hour or so, chill out, do things you enjoy, maybe soft music, wind down for the day. Don't read an interesting, stimulating book. I wouldn't suggest sex at that time of the day if possible, but that's a personal preference. We just want to be calming down, preparing, and get ready for sleep. And the last two things are specific relaxation treatments. So there's the progressive muscle relaxation technique. That's when you lie in your bed and you tense the muscles in your feet first. So you breathe in, tense the muscles, and then on the exhale, release the tension in the feet. And then on the next inhalation, you tense, say, the leg muscle or the calf muscle, you pause, and on the exhalation, you relax that muscle. And then you work up the body sequentially, the thigh, the abdomen, the buttocks, the low back, the chest, the upper back, you can use shoulders, arms, forearms, hands, and then maybe finally the face. Give your face a good old screw up like this, and then just relax on the exhale. So a really helpful technique because it really relaxes your muscles and just takes your mind off the fact that you want to sleep. And then one really good one to finish, just do the whole body, big old squeeze, and then relax and into the exhalation, and just lie there and enjoy the warmth, enjoy the fact that you're comfortable. We're in a peace-loving country, and you've likely got food in your stomach, and look at the good things in life. And the very helpful tip that I've used myself. And the last thing, just a general statement, quieten the mind. A lot of people meditate at night or do their prayers. Some people write, and I encourage writing. Some deep breathing, some imaginary pictures in your mind. Maybe you're in the beach somewhere in Hawaii, or your local beach, wherever you may be, and just enjoy it. Calm the minds. So these are a lot of activities. So went through the cognitive elements and some behavioral elements. And if you integrate some of this, by far more important, I think, than medications. If you need them, you do, and that's fine. But let's optimize the simple, cheap things with no side effects. So lots of take-homes tonight. Just grab a few of those, implement them, listen to the video again, or several times to get a few of these different techniques. And I encourage you to leave your feedback. How did you get on with these techniques this week? Any questions for me on the whole issue of sleep and maybe the science of sleep? So I'm most welcome to answer these questions. I look forward to them, and I hope you enjoyed tonight's little chit chat, and I look forward to future ones coming up. So I wish you all the best, happy sleeping, and we'll see you on the next. Thanks for now. Take care and have a great night.